Good morning, class. So, amo ni siya aton module 17, ang lymphatic system. So, hindi ko lang siya masyado pag i-anugid ang lymphatic, ang mga important details lang gid ha. Okay? So, ang lymphatic system and immunity ang topic ta. So, primary function is returning fluid from tissues to the heart, then transporting large molecules like ang hormones and lipids naton into the bloodstream and facilitating immune surveillance to prevent infection. So, muna siya ang lymphatic system natin, ha? Then, usually, ang functions ng lymphatic natin is fluid balance. So, fluid balance in tissues and fat absorption and house of the body's defense. Okay? So, mani siya, makita nyo di sa picture, mani siya ang lymphatic system natin. So, ang mga bilog-bilog na green, isang ginatawag nga lymph nodes. Okay? So, ang lymph nodes is muna siyang rounded structures distributed along lymphatic vessels and has 3 superficial aggregations on each side of the body. So, ang ginatawag nga inguinal nodes in groin. Ari siya, oh. So, inguinal nodes in groin, axillary nodes in armpit, and cervical nodes in neck. Okay? So, ari sa mga neck naton, cervical lymph nodes, inguinal lymph nodes, kagang axillary lymph nodes. Okay? So, ang capsules surrounds each node's extensions are called tuberculae. Okay? Ang trabeculae that subdivided the node into compartments. The lymphatic nodules and lymphatic sinuses. So, ang lymphatic nodules, dense aggregations of tissue formed by lymphocytes and other cells, contain rapidly dividing lymphocytes called germinal centers, and lymphatic sinuses, spaces between the lymphatic tissue that contains the macrophages. As lymph moves through each nodes, 2 functions are performed. So, activation of immune system and removal of pathogen from lymph through macrophages. Okay, tandaan ha. Activation of immune system and removal of pathogens from lymph through macrophages. Okay? So, ang lymph naton is fluid that flows within lymphatic system. This occurs when some fluid moves from blood capillaries into tissue spaces, or most of fluid returns to blood. So, moves from tissue spaces into lymphatic capillaries. Okay? So, lymphatic capillaries are tiny close-ended vessels more permeable than blood capillaries, and fluid moves easily into contained valves from overlapping squamous cells into the walls that prevents the backflow of fluid. Okay? So, ang lymphatic vessels, amo ni sila, oh. Lymphatic vessels. So, ang lymphatic vessels where lymphatic capillaries join resemble small veins that have a beaded appearance. So, makita nyo ito, beaded, diba? Ang makita nyo dire. Beaded appearance. Valves prevent backwards and cause forward movements through vessels when compressed, caused by factors: contractions of skeletal muscle due to activity. Number 2, periodic contraction of smooth muscles. And number 3, pressure changes in the thorax during breathing. Okay? So, next. So, ang lymphatic tissue naman is characterized by housing many lymphocytes and other defense cells, or ang ginatawag na macrophages, and has very fine reticular fibers that trap microorganisms and other items in fluids. Okay? So, ang other lymphoid organs naton sa aton lymphatic system, other lymphoid organs are ang tonsils, thymus gland, and spleen. Okay? Tonsils naton. So, ang tonsils naton are small masses of lymphoid tissue that ring the pharynx, or ang throat, where they are found in the mucosa. Okay? 3 groups na ang tonsils naton, ha. So, ang 3 groups nga na is ang palatine tonsils, pharyngeal tonsil, and lingual tonsil. So, ang palatine tonsil are paired located on each side of posterior opening of oral cavity may become chronically infected and must be removed surgically through tonsillectomy. So, ang procedure nga ginatawag kung mag-remove kita tonsils is ang tonsillectomy ha. Pharyngeal tonsil naman located near internal opening of nasal cavity where enlarged adenoid can interfere with normal breathing. Can be surgically removed through adenoidectomy. Okay? Kung enlarge ang adenoidectomy ang ginatawag kung i-remove na siya. So, lingual tonsil on posterior surface of tongue, less often infected and more difficult to remove. Okay. So, mas common gid ang tonsillectomy. So, gina-remove na siya kung always always ka gina-tonsillitis, do grabe, nagidi mo tonsils, usually gina-tonsillectomy na ina siya. Okay. So, ang spleen naman, next, aton spleen. Aton spleen is soft. Soft na siya. Ang soft and blood-rich organ that filters the blood. Okay? Ang aton spleen. So, functions ang aton spleen is instead of filtering lymph, the spleen filters and cleanses the blood of bacteria, viruses, and other debris. It provides a site for lymphocyte proliferation and immune surveillance. But its most important function is to destroy worn-out red blood cells and return some of their breakdown products to the liver. Okay? Ang aton ng spleen. So, tandaan ha, gina-destroy niya mga worn-out red blood cells and gina-return niya ang iban nga breakdown products into the liver, ang spleen naton. So, ang spleen is mayara man kita sa ginatawag nga white pulp and red pulp. So, makita mo diri nga side ang puti, white pulp, and ang red pulp. Ara siya. Okay, the red pulp and white pulp. So, ang white pulp surrounding the arteries within the spleen and the red pulp associated with veins filled with macrophages that remove foreign substances and burn out RBCs through phagocytosis. Okay? So, ang surgical removal naman, medical surgical removal of spleen, tinatawag nga splenectomy. Okay? Splenectomy. Tanan niya removal, may ectomy. Splenectomy. Okay? Like tonsillectomy. Tanan may ectomy. So, it's meaning sa ectomy to remove. Okay? Next, we have the thymus. So, ang thymus naman is, manisyaton niya thymus ha. Ang thymus gland naman naton is, function niya is peak levels only during youth. Okay? So, ang functions ng thymus gland is produce a thymosin and others that functions in the programming of certain lymphocytes so they can carry out their protective roles in the body. Okay, so ang location, so the thymus gland is lymphoid mass found in the low throat overlying the heart. Okay, so overlying the heart. So, muna siya aton nga thymus. Okay. So, sa aton module, may kita, so, ang aton nga thymus is located in superior mediastinum that contains cortex and medulla. So, cortex and medulla is cortex, dark staining areas formed by numerous lymphocytes, and medulla is lighter staining, so central portion of lobules that has fewer lymphocytes. Okay? So, muna sila ang other lymphoid organs, ang tonsils, thymus, and spleen. So, next ang immunity, so meaning ability to resist damage from pathogens, harmful chemicals, and internal threats. So, making a person immune in second exposure before any symptoms develop. So, categorize in innate immunity and adaptive immunity. So, ang innate immunity, ano na siya? When you say innate, ha, tandaan, present at birth na siya. So, innate immunity or non-specific resistance. Resistance meaning present at birth. The body recognizes and destroys certain pathogens, but the response is the same each time the body is exposed. So, mechanism of this immunity include, number 1, aton nga physical barriers. So, prevent pathogens and chemicals from entering the body in 2 ways. So, pwede siya maging skin and mucous membranes that prevent the entry, and tears and saliva and urine that wash substances from body surfaces. And number 2, chemical mediators. So, molecules which include mga lysosome, mucus, complement, interferons, histamine, prostaglandins, and leukotrienes. Number 3, white blood cells. So, may idea naman kamo, di ba, kanong white blood cells. Sila may mga neutrophils, macrophage, basophils, mast cells, eosinophils. Kag may kita ginatawag nga sa white blood cells ang natural killer cells or ang NK cells. So, a lymphocyte that recognize class of cells such as tumor cells or virus-infected cells. So, kill target cells by releasing chemicals that damage cell membranes and cause cell lysis. And number 4, inflammatory response. So, it stimulates release of chemical mediators. So, the amount of mediators and phagocytes increase until the cause of inflammation. If destroyed, mediators produce several effects. So, like vasodilation, increased blood flow, and brings phagocytes and other WBCs to area. And phagocytes leave the blood and enter the tissue. And increased vascular permeability allows fibrinogen and complement to enter the tissue from blood. Okay? So, may makita galing inatawag na local inflammation and systemic inflammation. Ang local inflammation is inflammatory response confined to a specific area of body, produces redness, heat, swelling, pain, and loss of function. And systemic inflammation, a response that is generally distributed throughout the body, produces local symptoms and 3 additional features. So, increased neutrophils, may fever, presence of pyrogens. Kung may fever, tandaan, kung may fever, so, presence of pyrogens. And decreased blood volume, or kung ma-shock na siya. So, once mag-decrease ang blood volume, shock na siya. And we have here, next, the adaptive immunity or specific immunity. So, ang adaptive immunity naman, so body recognize and destroy pathogens, but the response improve each time the pathogen is encountered due to 2 certain characteristics. So, ang yatawag na specificity, memory. So, ang specificity, here, so ang specificity, ability to recognize a particular substance. And memory, ability to remember previous encounters resulting to faster, stronger, and longer lasting response. Okay? So next we have the antigens. So antigen, substance that stimulate adaptive immune responses. Exposure to these increases the effectiveness of successive exposure, divided into 2 groups. So, ang ginatawag natin nga foreign antigens. Ang foreign, introduced from outside of the body, and self-antigens produced by the body that stimulates immune system response. So, ang foreign antigens, example niya is ang drug-causing allergic reaction. Okay, so mga drugs, mga bulong nga produce ang allergic reaction sa aton body. And self-antigens naman, example niya is autoimmune disease. Okay? So, lymphocytes are responsible for the responses of adaptive immunity developed from stem cells that give rise to pre-T cells and pre-B cells. Okay, so may kita ginatawag sa lymphocytes, pre-T cells and pre-B cells. Okay. So, 2 events of lymphocytes in adaptive immunity. So, we have antigen recognition and lymphocyte proliferation. Okay. So, tandaan nyo lang, ang antibodies is produced by plasma cells and bind to the antigens that are Y-shaped molecules consisting of variable region and constant region. Okay? So, So, tandaan nyo, ang antibodies, protein produced by the body's immune system to help destroy harmful substances na sila called nga antigens. Okay? Ang antibodies naton. So, muna ang protect sa body naton sa mga harmful mga pathogens ang aton or mga bacteria, viruses. Okay, so dapat taas ang antibodies naton. Muna sila. Okay. So, ang effects ng aton antibodies is inactive antigen, bind antigens together, active complement cascades, initiate release of inflammatory chemicals, and facilitate phagocytosis. Okay, so antibody production. So sa antibody production naton, meron kita primary response and secondary response or ginatawag nga memory response. So ang primary response results from first exposure of the cell to an antigen. So person usually develops disease symptoms because the antigen has time to cause tissue damage. And secondary response or ginatawag na memory response initiated by memory B cells to quickly form plasma cells responsible for formation of new memory cells. Okay? So, next sa aton category sang adaptive immunity is ang cell-mediated immunity. So, ang cell-mediated immunity involves the action of T cells, most effective against microorganisms that live inside body cells, also functions in allergic reactions, control of tumors, and graft rejections. Essential in fighting viral infection by destroying virally infected cells. Okay? So, muna natin mga types of T cells naton ha. Cytotoxic T cells, helper T cells, and memory T cells. So, 4 ways to acquire adaptive immunity. So, acquired adaptive immunity. So, mayroon kita ginatawag nga active immunity and passive immunity. So, ang active immunity is provided by the individual's own immune system. So, mayroon man na siya natural and artificial. So, ang natural antigens are introduced through natural exposure, and artificial antigens are deliberately introduced like ang vaccine naton. So, mga vaccines naton artificial na sila, and ang natural mo nang nakukuha talang sa environment. Okay? Through sa mga exposure naton sa different kinds of environments. Next, we have the passive immunity. Ang passive immunity is transferred from another person or an animal. Okay? So, passive immunity. So, type of immunity na siya that occurs when a person receives antibodies to a disease from another person rather than producing them through their own immune system. So, passive immunity can occur naturally or artificially. So, kung natural, so when a baby receives antibodies from their mother through the placenta or breast milk, na siyang natural. So, kung sa artificial naman, so when a person receives an injection of antibodies such as immune globulin to protect against a disease. Okay? So, muna siya ang sa passive immunity, ang natural kag artificial sa passive immunity. Okay? So, mayari gali ko di sang lymph flow or ang ato na pathway. Anyways, may dugang gali ko sa immunity. Okay. So, naano ka naman mga active immunity. Wait. So, manigali ha, may mga immunotherapy kita. So, treats disease by altering immune system functions or by directly attacking harmful cells. This can be done through administer cytokines to promote inflammation and activate immune cells or block the expression of MHC molecules that display self-antigens. So, vaccination can prevent many diseases. Okay? So, mga disease and disorders of lymphatic system, amo ni silang multiple sclerosis, or ang isa pagid ang SLE, or ang systemic lupus erythematosus. Okay, so muna sila. So for the immunity gali, so di ba hamba ko gani, di ba? Munang vaccines ga-help sa aton para magka-antibodies kita. Di ba? Munang mga vaccines naton today. So, ang mga booster shots naman, so mga so-called booster shots, so which may intensify naman ang immune response at later meetings with the same antigen. 'Di ba? So, muna ako example, like ato yung mga COVID vaccine, 'di ba may mga booster shots kita. So, may kita antigen na 'di ba from the previous vaccine, then nag-booster kita to intensify it. Okay? So, muna siya. So, muma lang na sa antibodies. Okay. Sorry, ang lymph flow. So, path of lymph flow through a lymph node. So, makita nyo galit dire ha. Ang normal lymph nodes natin is munilang tsura. Ang green ni balao munilang tsura. Pero kung swollen, makita nyo duga dako ang lymph nodes nato. Usually, di ba makapa nyo kung sa may neck yun ang area, usually daw damo nga duga ga inflame ila lymph nodes, muna gina fever na sila dason, muna dira makapa nyo na kung swollen ang lymph nodes nyo. Okay, then may mga antibiotic na nga i-prescribe ang doctor sa inyo if ga-inflame ang lymph nodes. Okay, so lymph flow. So efferent lymphatics, efferents to bring out. So leave the lymph nodes at the hilum. So these vessels collect lymph from the medullary sinus and carry it towards the venous circulation. Ay, sorry. Nag-start ko sa babaw. Okay, sorry ah. Let's start from the start. Start. Sorry. So, ang start naton is here gali. So, afferent lymphatic. So, afferents. Ari siyang start. So, afferents to bring to. So, carry lymphoid to the lymph node from peripheral tissue. The afferent lymphatics penetrate the capsule of the lymph node on the side opposites of the hilum. So, the afferent vessels then deliver lymph to the subcapsular space and meshwork of reticular fibers, so macrophages and dendritic cells. So, ang dendritic cells are involved in the initiation of the immune response. Sorry, siyang hilum, ginatawag ko or hilum. So, lymph next flows into the outer cortex, which contains B cells with germinal centers that resemble those of lymphoid nodules. And then, lymph then flows through lymph sinuses in the deep cortex, which is dominated by T cells. Then, lymph continues in the medullary sinus at the core of the lymph node. So, this region contains B cells and plasma. So, efferent lymphatics. So, efferents to bring out naman. So, di ba ang afferent bring to? Then, ang efferents is bring out. So, leave the lymph node at the hilum. These vessels collect lymph from the medullary sinus and carry it towards the venous circulation. So, muna natin lymph flow. So, you can screenshot this. May copy lang ka mo. Okay? So, that's all for Module 17.